Today, the Snohomish Health District is announcing new recommendations to help slow the spread of the novel coronavirus disease, or COVID-19, in our community. Yesterday, I declared a public health emergency for Snohomish County on this basis. Proclamations like this make it easier for us to work with our partners and to use the best available strategies to keep our community safe and healthy. We need this flexibility to respond to COVID-19. This situation continues to evolve rapidly. As of this morning, we have the following cases. We have 13 confirmed and presumptive cases, 2 probable cases, 37 possible cases waiting test results, 14 we were concerned about COVID-19, but their test results are now negative, for a total of 66 cases investigated thus far. Given the continued number of cases here in Snohomish County and around the state, it is important that we take action during this key time when prevention strategies can make a large impact in slowing the increase in cases in the short run and ultimately reducing the total number of cases that occur in the long run. We are making these recommendations based on our best understanding of this new disease and doing so with guidance from the Centers for Disease Control and Prevention, the Washington State Department of Health, and our colleagues at other local health jurisdictions. We understand that these steps will require coordination and may cause difficulty for many in our community. We are recommending these steps, but we are not requiring them at this time. I want to reemphasize that these are currently recommendations, but not mandates. We know that COVID-19 spreads among close contacts, and that reducing close contact with others can help reduce the spread of disease. This is a prevention strategy used for many other illnesses, and we call it social distancing. For social distancing to be most effective, it must be combined with other illness prevention steps. That means we need people to continue washing their hands, avoiding touching their eyes or mouth or nose, and they should clean and disinfect frequently touched surfaces in their environment. It is crucial that those who are ill with fever or symptoms like coughing or shortness of breath stay home and stay away from others. Here are the social distancing strategies that I am now recommending. With respect to gatherings, as of today, we are recommending that people avoid non-essential gathering in large groups to the extent possible. We are loosely defining large groups as meetings, events, or spaces with 50 or more people. However, people also need to balance the risk to their individual health and the community against the benefit or need to gather. The larger the group, the higher the risk. The closer the contact between individuals, the higher the risk. The fewer the number, the lower the risk. The further apart, the lower the risk. This is a good time to consider postponing events if possible. For people who are at higher risk from COVID-19, extra precautions should be taken. This includes people who are over 60 years of age, people who are over 60 years of age, and people who have underlying medical conditions like heart disease, lung disease, or diabetes, or who have weakened immune systems, or who are pregnant. Any of those categories are considered at increased risk for serious disease. If you have questions about whether you or your child is at higher risk from COVID-19, ask your healthcare provider. We are encouraging workplaces and businesses to provide options for their employees to work from home, if possible. If they cannot work from home, employees should minimize their interaction with large groups of people. People who are sick with cough and fever should not attend work until 72 hours after the fever has resolved or 7 days after the illness began, whichever is longer. We urge employers to maximize flexibility and sick leave benefits to accommodate these measures. For schools, we continue to be in close communication with our local school districts. I had a call with the superintendents in Snohomish County this morning. We know that closures have a large impact on students, staff, and families and require a lot of coordination and cause disruption. As of today, Snohomish Health District is not requiring school closures. However, we all have a common interest in preventing transmission of COVID-19 and other infections in schools. We will continue to work with the school leaders to determine the best measures, including potential school closures, and to support school officials in making the best decisions for their students and families as time goes on. Our school districts have been great partners in identifying the right steps for the health and safety of our community. Watch for further communication from your local school district as well as from the health district. If our recommendations change and we look at either targeted or widespread school closures or postponement of group activities, we will let you know quickly. About contacting your healthcare provider. People who have questions about specific symptoms or care should contact their healthcare provider by telephone. If you have cold or flu symptoms, especially cough and/or fever, it is important that you call ahead before going into a clinic. I want to emphasize that anyone who is ill should stay home and stay away from others. Even if you are feeling well, please avoid visiting hospitals, long-term care facilities, or nursing homes. If it is necessary to visit someone there, check on the facility's rules for visitors before showing up, and limit your time there and stay at least 6 feet away from patients at all times. For those who have symptoms like cough or shortness of breath or fever, contacting your regular medical provider by telephone is the best thing to do unless you truly have an urgent need that requires immediate care that would take you to the emergency room or urgent care center. Use the phone. Most cough and cold illnesses can be cared for at home with advice from a healthcare provider over the telephone if needed. Please do not go to emergency rooms or urgent care clinics if your illness is mild and can be managed at home. We need to save that space for people who are moderately to severely ill and need the limited space available in those settings. These facilities need to have the ability to serve those who are in most critical need, and we want you to protect healthcare providers and other patients from catching infections during visits that were not really necessary. About testing. We now have somewhat expanded testing options for coronavirus testing in Washington. People still need to contact their medical provider if they are ill in order to be evaluated for testing, and it is not absolutely necessary for everyone with a cold to be tested for coronavirus. The University of Washington is now offering the same COVID-19 test as has been offered by the State Public Health Laboratory. Healthcare providers can request that testing through the University of Washington Department of Laboratory Medicine. Information on how to do this was sent out to healthcare providers on Tuesday. It was the latest in a series of health alerts we have been sending to our medical community about COVID-19 and will continue to do so for the foreseeable future. Those who are being tested for COVID-19 are to remain isolated at home while results are pending. Others who live with them but who are not ill will only be required to enter quarantine, that is, stay home, if the test results are positive, or if they become ill as well. Tracking data on COVID-19. The number of COVID-19 cases in Snohomish County is expected to change frequently. We are now providing twice daily updates on our website at 11 a.m. and at 4 p.m. It takes our disease investigators time to look into cases, and details on specific cases are not available right away. With the expanded testing options, the health district is no longer coordinating every single COVID-19 test requested on a Snohomish County resident. This means we are no longer able to confirm to employers or schools whether a specific employee or student has been tested. We are notified of all positive results, and that is when our disease investigators begin their work. Close contacts of a positive case are notified by public health to quarantine for 14 days while monitoring for symptoms. If there is a case in someone at school, in a workplace, or in another facility, there may be additional communication from the affected facility to notify students, staff, and families that also attend that setting. The health district is coordinating with local partners to help provide accurate information and guidance. In closing, information continues to change frequently on COVID-19. I know that people are worried about the disease. First, remember that this is a mild or moderate illness for 80% of cases. Though the disease is new, it is caused by a respiratory virus, and we have proven methods to help prevent the spread of these kinds of illness. This is the time to stay calm, stay informed, be prepared, and think of others. Wash your hands with soap and water frequently, especially after having physical contact with others, being in public places or healthcare facilities, before eating, after going to the bathroom, when leaving work or school, and upon returning home. Stay home when you're sick. Stay away from other people who are sick. If someone else at work or at school is sick with a cough or cold, make this known to someone in authority so that that person can be asked to leave and go home. Cover your coughs and sneezes with a tissue, throw it away, and then wash your hands. Clean frequently touched objects and surfaces with a disinfectant. These recommendations I have shared today can help us all slow the spread of the disease and will save lives. Please support these efforts to reduce the impact of COVID-19 in our community. Thank you for your attention and for paying attention to these recommendations and for your own health and taking consideration for the health of others.